Hi, everyone. Welcome back to Fueling Tomorrow. I'm your host, Erin Bailey. And today we are joined by Russell Meyers, who's the CEO for the Beacon Alliance. And Russell, thank you so much for joining us
Thank you
today.
very much for having me. I'm glad to be here.
We're so excited to learn all about the new things in healthcare for the Permian Basin, but let's take it from the beginning.
Okay.
You've had quite the career in healthcare. So, talk to me about did you always know you wanted to get started in healthcare?
No, there's a story there.
Yeah, tell us
So
the story and then take us through the path of how you got to where you are today.
will do. It starts with my relationship with my wife. We go back to the 6th grade and really have been pretty much
Wow.
continuously together since the 8th grade. And we got married pretty young. We were 21, and one of the reasons we were able to get married young was she was about to become a nurse, and she was going to support us while I finished school, and
You're like,
so she
great.
did. So her first nursing job was at one of the big hospitals in the Texas Medical Center in Houston, and I didn't know anything about healthcare, had never been exposed to it. Frankly, first person in my family to get an advanced education of any kind. So
Nice.
healthcare was new to me and to her, and her first experience was terrible. She was a new registered nurse, baby nurse, left alone on a 45,
Oh my
48 bed
gosh.
patient unit, lots of critical patients, and it was pretty common in those days. This is the early '80s, long
Okay.
ago, and it just was a mess. And while I didn't know a lot about anything, and I didn't really have a career path, I thought this is something that could use some help.
Some change. Yeah.
Right. And so I was finishing up my undergrad and sought out a graduate program in healthcare administration and just took off.
Wow. So what were
So,
you originally going to school for?
well, my undergrad degree is in economics, which obviously is not applicable to much of anything except
Still
grad
a
school.
degree. Yeah.
And so I needed a grad school path, and this is the one I found. So
Wow.
turned out to be great. And I got my start early on at Methodist in Houston, there in the Texas Medical Center, which is a great place to start. They were doing a
Mhm.
little bit of everything, a real world class institution, and I was there for a few years, and then on to lots of other things. We could go on and on about that, but I've had multiple different career stops.
And what
I
brought you
got here.
to the Permian Basin?
I was recruited here to be the CEO of Midland Memorial Hospital. That was after 12 years with HCA, which was the biggest for profit healthcare company in the country. And there's a lot of good that came of that. But I realized that healthcare, for me at least, was a nonprofit, community oriented
Mhm.
enterprise. And when your first duty is to the shareholders, like it is in any corporate environment, you can't really do, unless you're Diamondback, you can't really do
Yeah.
all the great things in the community that really brought you to healthcare in the first place, brought me to healthcare. And so I was looking for something different, something really community oriented. Midland Memorial's longtime CEO was retiring. They were searching. We met up on a wanted help wanted ad, and
Wow.
they brought me here to be the CEO. That was in 2002.
Had you been to the Permian Basin before?
Never. I grew up in Houston, lived my whole life on the Gulf Coast, knew Midland was in Texas, and that's about it. I'd
It
never
was a
been
dream.
anywhere near here. No, so it wasn't I didn't come here because it was Midland. It was a great job opportunity, and obviously it's a different place from where I grew up, but came pretty quickly to love it. So,
And you quickly planted roots here and have been here for quite some time. So talk to me about how you got to the CEO of the Beacon Alliance.
well, I spent right at 20 years as CEO of Midland Memorial and was fortunate that the board worked with me and my number 2 person, Steve Bowerman, to plan his succession into my role over the course of about 18 months. And so, as we came to the end of that, I was working on a behavioral health idea, that we had not been able to achieve, but and we can talk a lot more about that if you want
Yeah.
to. But so I stayed around to finish the behavioral health development, and around that same time, I spoke with Chairman Don Evans, who was getting the he was chairman of Permian Strategic Partnership,
Mhm.
had this idea for what became Permian Basin Medical Center or the Beacon. But the idea was that Midland is booming. It's going to continue to be it's the most important energy producing region of any place in the world, really, certainly in the U.S. But it had some shortcomings. Our education wasn't what we wanted it to be, and our infrastructure was was inadequate to serve the oil field. And healthcare was not good enough
Mhm.
to attract and retain the kinds of people it would take to drive the energy industry into its long 50 to 100 year, path forward. And so they were thinking about what could the industry do to make a difference, to make those things better. And the healthcare part of it, I was certainly interesting and attractive to me. Don asked me to come on and give some shape to this new idea to do something bigger in healthcare, and so I said yes. I was available, so it turned out to be a pretty good decision. That's been 3 years now.
Wow.
For me. The idea came up a couple of years before that, but I've been involved for 3.
And if someone came up to you, because to a lot of people, the Beacon Alliance is new. Well, it is only 3 years old, so
Well,
it's
it's
new to
still new.
everyone,
Yeah, it's
really.
still new. Yeah.
But if someone knows nothing about it, if you could describe it in a few sentences, what would you tell them?
I can. I think I can. So it's as I with the it really grew out of the Permian Strategic Partnership Initiative, which was trying to make Midland a better place and a more attractive place for people to come and live and work and plant roots and stay. Um, this is the healthcare arm of that effort, and it's exists really, I think, to do two things. One is to develop what has become about a 400-acre property, most of which was donated by Diamondback affiliate
Yes.
Rattler Midstream. Tremendous gift. This is north of the Midland Airport, just south of the UTPB campus and the Wider Noel Performing Arts Center.
Mhm.
A great big piece of surface that Diamondback owned and didn't need. They need what's under the ground, not necessarily what's on top, right? And so they were gracious enough to donate it toward this effort. And developing that site into something that is a sort of a planned community, but it's centered around enhancements in healthcare, things we can do together as a region that maybe the individual cities of Midland or Odessa or others around the region can't do on their own that would make healthcare better for the whole region. That's job one. The other part is a regional outreach effort, recognizing that most of the Permian Basin, at least its geography, is very rural. A lot of small towns, a lot of oil and gas resources around the region for sure, but centered in really small towns with very little capability healthcare wise, and with a need to tie to a regional provider network so that the people in those towns can get the best care possible, even when they live in remote areas.
Mhm.
And so we're doing outreach in areas like health improvement in small communities, helping people understand their health status and get
Okay.
treatment for chronic disease, oftentimes that they don't even know they have.
Yeah.
Diabetes around the region is really difficult, and a lot of people are pre-diabetic and don't know it. And so we're trying to
How do you
get it in
screen for
front of
something
them.
like that?
I'll tell you about that
Okay.
project. And then another part of that is outreach to the 911 community. EMS providers around the region all struggle one way or another with resources, with manpower, workforce, but they're all depended upon by many times the oil field industry. Right? You've got a guy out on a remote rig, he gets hurt. Somebody's got to show up in an ambulance and take him
Yes.
to the hospital. And making sure that the region has the resources it needs to do that well is another piece of our mission. So it's regional outreach to the rural communities, and it's development of this regional center to enhance really more specialty healthcare on the Beacon site. You asked how we
Yeah.
find those diabetics, right? This is a great story. Everything ties back to Don Evans. This is another tie back to Don Evans. You probably know that Don was the Secretary of Commerce under
Yes, he's been a guest on the podcast.
well, you know him
Yeah.
well. So under President Bush, one of President George W. Bush's great signature achievements was PEPFAR. I don't know if Don can't go too far without talking about it, so he may
We
have
had
talked
to
about it
reel him
on.
in to talk about the PSP.
Yes, it's challenging, but PEPFAR is a great achievement, and what that is the president's effort to reach into Africa, to rural Africa, with AIDS prevention and treatment. Remember, when President Bush was president, AIDS was still relatively new.
Mhm.
Treatment for it was beginning to succeed, but wasn't available widely. And in the underserved, poor areas of the world, especially in Africa, AIDS was rampant. It was horrible, epidemic disease, and it was unchecked. And so the president had the idea: we're gonna take some American resources, go to Africa, and help people get the care and treatment and the education they need to combat this horrible death sentence. It's not so much a death sentence anymore, but it was then.
Yes.
And so the person that he tapped to lead that was a career military doctor named Deborah Birx, Birx. You may remember Dr. Birx. You and I spent a lot of time together
Yes.
during COVID. Dr. Birx was front and center in a lot of the press conferences that President Trump held during the COVID crisis. Kind of number two person at the CDC to Dr. Fauci. Dr. Birx was the lady with the scarves. She was
Mhm.
great camera presence. She's a fascinating and charismatic character. Career military. She's an immunologist, and she was the leader of PEPFAR and credited with saving, over 20 million lives in Africa. Just an
Wow.
amazing achievement. Not as well known as it ought to be, perhaps. So fast forward to the post presidency, the Bush Center in Dallas has been established in President Bush's library. Don's very active there, chairs their board.
Mhm.
So he and the president are very close. They're really, really good friends. And Dr. Birx uh, wasn't really retired, but she was continually bugging the president about what she learned in Africa and how it could apply to rural America. There are a lot of similarities. Rural Africa, underserved by providers, plagued by ignorance with regard to healthcare.
Mhm.
Um, both things very true in rural America. And so she thought, we learned so much there in doing the maximum amount of good with the minimum amount of resources. Let's bring that home and apply it in rural America. And wouldn't that be great? And the president finally had heard enough of that and called Don and said,
Do
"Can I
it.
give you Dr. Birx and let you work with her to do something in West Texas?" And so we did. And so she's gotten this project started with Texas Tech, and they're actually going to individual communities, surveying people, asking them about their health status, but also testing them, testing their blood sugar, and taking their weight and their blood pressure, and doing a basic physical exam to get a baseline for what their actual health is. Many of these are people who work hard, don't have time to go to the doctor, may not have good access to a provider, and oftentimes have chronic disease they don't even know about.
They find that they're receptive to this?
They have been. The first place they went was Crane,
Okay.
very receptive to their efforts. But it appears to me, Dr. Birx she will be a great guest for you, by the way.
Okay.
Uh, but it appears to me that the secret to their success in getting people to open up to them was one-on-one, in-person communication. They went and knocked
Mhm.
on doors, asked people, can we give you a health questionnaire? Will
It's
you
a
let
lot
us do
easier
that?
to trust someone when you can talk to them
They're
face
right
to
there in your
face.
face. And
Yes.
she is so charismatic. She did a lot of this
And
herself.
she won't let let 'em say no.
And no, she's hard to say no to. So that's been the secret. She's developed a team now, and they're in several other places, and intend to spread this all over the Permian Basin.
Wow.
And then the end game here is not to put more doctors in those towns. We're being realistic about it. We're not going to get a lot more healthcare access. What we can do is use technology and give them self-management tools.
Mhm.
They can monitor their own blood sugar, see what their diet does that affects it,
Oh,
monitor their
nice.
weight and their blood pressure. And she's collecting the data because it's all Wi-Fi enabled,
Mhm.
and then showing the results potentially to the federal government to get some funding to scale this up and do it maybe all over America. But it's very early, but it's really exciting. They've had great results.
And if
It's
someone is
fascinating what they've found.
I know, that's so nice. If someone is listening from one of those remote communities and they're like, "Wow, how do I get involved with this?" Where do they go?
I well, they can read a little bit about it on our website,
Okay.
thebeaconpermian.com. But really now it's still a pretty small effort. It's
Just wait
wherever
for
the
a
next
knock on the
place
door.
Dr. Birx is going, that's where that's gonna be. So if you happen to be in that town, she's been in Balmorhea, she's working on Pecos now.
Okay.
She intends to get to Hobbs in the relatively near future. But that we have to figure out how to scale it up, and we haven't really done that yet.
Baby
So
steps.
it's just she's that she's an itinerant preacher on the
Yes.
the wonders of managing your own health to avoid the healthcare system, really.
And the Beacon was formed from a collaboration of multiple different sectors: healthcare, education, community, industry. When you were working together, at what point were you sitting there and now and thinking, okay, this is actually going to work? We can actually get this off the
Yeah.
ground.
That's I think the biggest moment there was the behavioral health center. It's at the Beacon.
Mhm.
The Permian Basin Behavioral Health Center just opened, took their first patient this week.
Yay!
Very exciting, project, and, that's a long-standing need in the community, as most people probably recognize that behavioral health services have been in really short supply
Mhm.
throughout the region for forever, and this is another COVID, result. We all became much more aware of mental health concerns during COVID because
Yes.
we were living together, right? I
Mhm.
mean, everybody was confined to home. Their routines were disrupted, and those underlying mental health issues that have always been here. Somewhere between 1 in 3 and 1 in 5 of us has some kind of diagnosable mental health concern. They become really apparent, when you can't get away from each
Yeah,
other,
yeah.
And so, the federal government put a significant amount of money into what was called ARPA, the American Rescue Plan Act, if I remember right, or Recovery Plan. And that included money that could be used on behavioral health initiatives. The state of Texas had a big allocation from the federal government. And in 21, we went to the legislature and asked for some of that money to finally address the longstanding behavioral health concerns here. And we got a yes. We asked for $90 million. We got 40, and that was,
It's pretty
in
good.
this community, we can raise money for things that
Mhm.
matter, as we all know. And so that was a great seed for what would become what we hoped would become a 100-bed behavioral health center. Uh, 21, the money came from the legislature. We went out and raised the rest of the money pretty easily. Nothing's easy here, but people really stepped right up and supported it because they were aware of the concern. And then in 23, the next session, the lieutenant governor calls us and says, "We're excited about this. We want you to double the size, and we'll give you the money. We'll
Okay.
give you the money to do it." And this time, the state gave us more money, and it was almost enough to pay for doubling the size. So we got to a 200-bed hospital.
Wow.
And Diamondback was in the early stages of making the land available, and it was an obvious fit. It was at what could eventually be the Beacon. It was free. It was a
Mhm.
donation. So it was the perfect. It was right between Middle and Odessa, so it's centrally located. So we said yes, and that became really the anchor for this whole thing. That's what made it real to me.
Yeah.
This is something tangible we're going to do. We've got funded. We've got a plan, and this is the start of something really big.
And with your time at Memorial Herman, thinking
Never
Houston.
made it there, but
Yeah, Midland Memorial, you were already thinking about something to address behavioral health.
for a long time, yeah, yeah.
So getting to work on this and see it come to fruition, what is that like for you?
Well, I'm at the end of my career, and it's kind of a nice culmination to what I've been able to do or be a part of, at least. We started, in earnest back in 2015 at Midland Memorial, really getting serious about understanding our mental health needs. When I first came, one of the early things that I did in the early 2000s was redefine the mission of the hospital. And what we said was it's leading healthcare for Greater Midland. In the unique place that Midland Memorial occupies, the only hospital in a county of 180,000 or more
Mhm.
people, they had a really high level of responsibility for healthcare here, not just for running the best hospital that we could, but the whole continuum of care. Because if we didn't own that, if we didn't feel responsible for it, who was going to? And so we defined our mission that way. And for all that time since we defined the mission until we started doing something about it, it was a great big hole in that responsibility. It was an area we didn't address. We knew the need was there. We didn't know how to address it. We had never addressed it. So it was a way we could step up and finally fill that hole and create the last piece of the continuum of care here. And so, yeah, getting to do something about that, convincing people that it was worthy of funding and their time and effort was pretty great. And I'm really proud of it. I've a great chance to work with a lot of good and generous people to make it happen. We're really fortunate. This is a really unique place, and it's going to be a real showplace for the state of Texas. And I think maybe the best part about it, I don't know that it's well known, but this facility, while it has a lot of funding from the state, it's not a state hospital. They just gave us the money and said, go do it. But it's a partnership between Midland County Hospital District and Ector County Hospital District,
Mhm.
Midland and Odessa, which is pretty rare.
I know,
And
we're starting to
we're
bridge
pulling it
that
off.
gap.
Yes,
Yeah.
that's right. And it's really tangible, and it was founded not only for these communities, but really to serve the whole region. And I think it's going to do that. It might take a few months for us to get all the way ramped up, but I think it's going to make a huge difference in the lives of people across the whole region.
Healthcare has always been a topic of conversation as the communities grow, just like education. With behavioral health specifically, people who have never dealt with it can't really understand why that need is so great. So what do you tell people who think that in their mind, but also that 200 bed facility really does have a greater purpose to serve the communities here?
We've spent we really started, I mentioned 2015. One of our early projects was to raise people's awareness, to really communicate a lot about what's going on in behavioral health, and, how to understand what your role is in it, and communicate the idea that, all of our families,
Mhm.
everybody knows somebody who's got a mental health concern. It may not be diagnosed. There's a really good chance it's not being treated because we don't have a lot of treatment available yet. But we have to continue that. We have to be really visible. I think one of the plans for the hospital when it's fully up and going is to have one number, hopefully the national 988 number, which was established a few years ago. If you think you have a mental health concern, you pick up that phone and call 988, just like you might call 911. You'll get somebody on the other end who can steer you, can understand enough of your needs to steer you to somebody who can help you. We hope to be that hub. One of the things we'll advertise about the hospital, one of the things we'll really emphasize the most is it has a walk-in center. It's got a crisis center where if you or your family member think on any level that you have a concern, show up and we'll help you sort it out 24 hours a day. Now we're not there yet. We're close, but we're not quite there. But that's going to be our message. This is the place. If you don't know what to do, if you got any inkling that you or your child or your parent might have a concern that relates to their mental health, call us and let us help you sort it out.
And with the Beacon Alliance, the Permian Basin Behavioral Health Center was the first project that kicked it all off. Going from that, another big part of it, like you touched on, is education. And in every area, it's sometimes we have the facilities, but how do you staff it? So, how
Right.
are you guys partnering with different educational partners to make that happen?
That's been one of the really heartwarming and encouraging parts of this whole process. We knew from the beginning that because behavioral health is so limited here, there is not a workforce. We're not going to recruit our people
It's not
from
just a
some
regular
competitor.
nurse, right?
No, it's well, every nursing job is really specialized these days,
Hmm.
but it's not just nurses either. There's a category of staff that really maybe are the most important called a behavioral health tech. This is the person who is at the patient's elbow day in and day out, in the public space when they're, uh, getting therapy or watching TV or hanging out during the day, going to meals with them, going to activities with them, organizing playtime and that sort of thing. All the aspects of their day-to-day lives are managed by behavioral health techs. Well, we don't
I
have any
didn't
of
even
those.
know. Yeah.
We don't have any of those. That's why you don't know, 'cause
Yeah.
there aren't any. But early on, uh, another great thing that Tom Craddock helped us do was get a little bit of money from the state to start up a behavioral health tech program. So Dr. Stephanie Caples, who works with me closely and was essential to the planning of this hospital, one of her early duties was to work with Midland College to build a curriculum to train people to be behavioral health techs. They've already graduated a couple of classes. We'll be
Oh.
hiring some of their people, but that's a really important need that we didn't have any people to do, and we got some state money and the work of the college to make it happen. Another area where we've had a real challenge is in counseling and social work,
Mhm.
master's level preparation for those folks. They're licensed in the state of Texas, but it's really hard to get from your master's degree, the completion of your coursework, to a license.
Okay.
3,000 hours worth of clinical time
Wow.
post graduation before you can get a license. And for somebody who might have been going to school part-time, trying to advance their education and their career, really hard to have a year and a half's worth of unpaid work before you can get your license.
Especially, yeah, especially in today's
It really
society.
is. And most people who would employ them, most entities, were small nonprofits. who were doing their best to get some counseling resources out there, didn't have a lot of extra money, didn't have big margins, they're dependent on grants and minimal amounts of third-party reimbursement. So
Mhm.
for those people to get a job in a place where they could get their hours was really hard. So UTPB has a really good program, but they had a backlog within their pipeline of students was pretty good, but they would finish their coursework or get close to finishing and then not get licenses because they couldn't get clinical work. We changed that two ways. PSP and the Scarborough Foundation stepped up to scholarship people in the master's programs in counseling and social work. Pretty significant investment there
Yeah.
at UTPB. And then we had several funders step up to provide postgraduate fellowship funding. And so, once again, another more of Stephanie Capel's work. Stephanie created with Texas Tech a fellowship program so that postgraduate these new counselors and social workers could go to work in primary care offices. And we can go down that rabbit trail if you want to, but primary care doctors see patients with mental health concerns every day,
Mhm.
right? It's widespread in the population. They're caring for everybody, and they have these patients they have no resources for, who are in their practices and oftentimes can't comply with the medical regimen that their doctor wants them to because their mental health concerns are unmanaged. You're a diabetic and you need to watch your blood sugar level, but your mind is foggy and you're struggling with an untreated mental health concern, you're not gonna be healthy.
Mhm.
So we're placing these new grads in primary care offices where they can get experience and serve that population that's there in those offices, and in need of some additional mental health service.
Oh.
And so we've had funding from all different sources, a lot of creative people working on these things, all intended to build our workforce, not just for the hospital, but really for the whole region. We need outpatient
Mhm.
practices too. Most people will never get to a behavioral health hospital, especially if we can make resources available to them early in their disease process, just like with any other disease, right? If you see your primary care doc and you do preventive work, then you're less likely to have an emergency hospital visit. Same thing is true in mental health. And the more counselors we can get out into the communities, the more accessible we can make psychiatrists, the better off people are going to be, and the less likely to get into a crisis and need a hospital.
Yes.
So we're hopeful that all those things come together and dramatically change the health status of people with mental health concerns.
Do you think there will be a point with what Dr. Birx is doing where she's doing the screenings for initial concerns with diabetes and things like that? Do you think it will get to a point where now these students will join her with that effort?
Conceivably, yeah. A lot of the effort she's making now uses current students,
Oh, okay.
and we just have a new crop starting for this summer that they're getting some field work. I mean, not all of them are public health or social work students, but they're getting some direct interaction with people in need out in the field, and
Mhm.
it might help shape them into future healthcare careers. And I hope so.
Yeah.
And it's all different
And we
aspects.
hope they stay in Midland.
Yeah, or at least in the region, right?
Yes.
Not just not maybe Midland, but the region is has a huge, a whole wide range of needs, and we need more people to plant roots here and stay and serve West Texas and southeastern New Mexico,
Yes. The whole Permian Basin.
the whole Permian. Yep.
When you think about all these different things that is going on for the health center, what will at what point will it be fully staffed? And what comes next for the Beacon after that?
Two good questions. Behavioral health center has a multi-month ramp up process planned, and has a wide variety of services they're going to provide. And I think it's going to take them probably until the end of this calendar year, to have everything live. Some of that is licensing. Some Medicare certification takes 2 to 3 months,
Okay.
which we won't be able to take Medicare patients. And frankly, most of our managed care payers with whom we would contract won't activate a contract until your Medicare certification is in place. So a lot of dominoes have to fall.
Yes.
And at the same time, they'll be ramping up the staff and ramping up their capability. So I would think that by the beginning of 27, pretty much all services will be available and all 200 beds will be open. That's
Wow,
that's our
that's
that's
pretty
our mission.
quick when you think about it.
I Yeah, I want
Maybe
it
not
I
in
want it
your
to be
mind, but
today,
yeah.
we've been building the place for 3 years, we
Mhm.
wanted to open and be 100% from the
Yes.
beginning, but just doesn't work that way, and we but it gives us a chance to do it really well, and take the time it requires to do this thing that we haven't done here
Mhm.
in, you know, anybody's memory.
You've touched on that it was a very long process, over 3 years to get to where we are today. What do you think it for you personally, what has it been like? This is a first for Midland. It's a first for a lot of you that are working together to make this happen. There have been quite a few hurdles, but talk about that.
Well, it's just really encouraging that we can do this. I think that the fact that Midland and Odessa are doing it together is a real it's a sign of great things
Mhm.
ahead, and we've worked really well together, and that's that is grounds for a lot of good things to come in the future. And of course, the communities are growing together. It's inevitable.
Yes.
Odessa's growing east and Midland's growing west, and they're going to meet in the middle at
Yeah.
some point.
Yeah.
There's no getting around it. But it's that's a really encouraging thing, and there's more really good stuff ahead. We behavioral health is from my perspective is kind of done. Our challenge now is to to determine what is the next thing we need to do. Our real overall objective with the beacon has been from the beginning to enhance
Mhm.
and add to what we can do now. Uh, there are hospitals in all over the region, really, but certainly in Midland and Odessa, they're doing really good work every day, and they have a lot to be proud of. But they can't do everything.
Mhm.
And as a growing community that's really focused on getting young people to come here and put their roots down and stay, we've got to do all the stuff that they could get in other communities that are competing for their time, right? I grew up in Houston. Um, we recruit a lot from the Gulf Coast
Mhm.
without question, and it's hard to compete with everything that's there in a city like that. But we have to in order to get the workforce here and keep them. So the next big step in healthcare is going to be to try to enhance what we are able to do here and to do it well. Specialty healthcare, doing a broader range, especially of pediatric care. That's a real concern for our average age here has plummeted
Yes.
just
Yeah.
in the time I've been here.
It's tots.
And yeah, we were talking about my daughter earlier. I've got a 4-year-old granddaughter here, and she's got thousands of friends.
Yeah.
There's so many kids here. I just can't believe it. When I came in early 2000s, the average age here was in the mid 50s. It's in the
Wow.
low 30s today, and so we're a dramatically different town, and pediatric care, the availability of basic pediatric care, and especially specialty pediatric care is gonna be more and more important to the people who wanna live and work here, right?
Mhm.
As your family grows, you gotta be able to take care of them. And so that's going to be a focus area. I don't know exactly what order things will come in. We're
Okay.
we're doing some studying right now. We've got a regional healthcare study going on that we'll have reports on in a few weeks, and that's going to somewhat inform our next round of efforts. Where do we focus our attention? And it very well might be pediatric care. Wouldn't surprise me at all because the need is so great, and it's so important to the community that's growing here. We've gotten really young.
Yes. And with the land that is was donated, there's obviously more room there besides just the behavioral health center. Are the plans for whatever comes in addition to that to be in that same vicinity?
Yes, well, to the extent that whatever makes sense to put there, we
Mhm.
will. I mean, there may be other things that belong in other places, but we've got 400 acres to work with out there, and the behavioral health center takes up. It was an initial 50-acre grant. Only about half of that is the property, and the rest of it is going to become a part of this great park that will be a part
It
of
for the people that haven't been,
development,
it's beautiful.
and it's going to be even better. I mean, it needs a little bit of development, but it's got really a good opportunity, and so that site is there's plenty of room there, not only for a variety of different healthcare buildings and providers. We've got what we call an innovation corridor planned. We don't know exactly who's going there yet, but we're hoping that
Something innovative.
something innovative will go there. That's right, and that will attract people who want to build new things and bring research and development to the region. That integrates with the healthcare we're delivering here and maybe with the oil and gas industry. I mean, there's a
Mhm.
lot of parallels conceivably. A lot of really creative people doing technology development in oil and gas, and some of that may be translatable to healthcare. We'd like to explore that. But also, the other thing that we are confident will happen in that region is places to live, residential areas of different flavors, entertainment venues. There's already, the region's best entertainment venue is
Yes.
arguably the Wagner Noel Performing Arts Center is right in the middle of our development. We think we can build upon that. We'd like to see hospitality there, perhaps a hotel. There's not really a great hotel anywhere near the airport, and we're
Mhm.
probably as close to the airport as you're gonna get. There's a lot of potential for multifaceted development on that site, and we're just now determining what do we pursue next. There's more things than we can do in the immediate term. We have to prioritize.
Yeah.
The first priority, which you'll begin to see, right after the first of the year, is road building, the major arteries that will serve that 400-acre property and the park. Man,
Okay.
I'm really excited about the park. There's,
Is it
big
gonna have,
ground.
like, a playground and a green space, all the things?
It is so running diagonally across the property is a system of playas,
Oh.
natural depressions in the earth
Mhm.
that carry water, that hold water, when it rains, but dry up between rains, and the ecosystem there is fascinating. It's got its own plant life and animal life that are attracted to that kind of environment. We're early in the design of the park now, but we're trying to respect that natural environment, take advantage of the plants that are native to this area and the water flow that happens in the playa. Believe it or not, out
Yeah,
there
I
in the
know.
desert, water does actually flow occasionally. We're trying to integrate with what UTPB does on their corner of that area and make it one big integrated park space. And what we want to do with it is tell the story of the Permian Basin. Uh, it- and it's too soon to know exactly how we'll do this, but the early ideas have had anything from the prehistoric era and showing, what the creatures look like who lived in the Permian
Cool.
Sea. This was all underwater,
That's
millions of
wild to
years
think
ago.
about, yeah.
The Permian was a sea, and so this is they're underwater creatures that actually died and decayed and became, the reservoirs of oil and gas that we all benefit from today. And
Mhm.
so starting with that prehistoric time, moving through the development of the shortgrass prairies that are endemic to this region, and the settlement of those prairies over the years, and then the development of ranching, and then oil and gas, and then something about where the future is taking us,
Wow.
all incorporated into a story that will proceed through this 80 or so acre park. And we're still figuring out what kind of amenities go in the park. We want to incorporate as much shade as we can,
Yes.
uh, as many different varieties of native plants as we can. We want the playas to be rehabilitated so that they're clean, and that we've
Mhm.
got a plan for dealing with runoff, which isn't always clean. Um, you know, Cleaning the water and making the habitat good for the native animals and birds that are here. And there's just a lot about it that could be really exciting. I don't know exactly what all goes in it yet, but it's going to be fun to develop.
And it's going to be so great for the patients and their families that are in these facilities. There is nothing better. My family has spent a lot of time in medical hospitals, but there's nothing better than getting outside and enjoying green spaces to help with all things mental health and just to get out of a hospital room.
We I think we really believe that we incorporated a lot of outdoor space into the behavioral health centers, really important part of the
Mhm.
recovery process, and throughout the development. We hope that virtually everything we build will have, at least close access to the park, for exactly those reasons. It's a really health growing, health improving kind of environment, and we want to celebrate what's beautiful about our environment. I mean, it's not a lot of trees, and
Yes.
it's nothing like what I grew up in on the Gulf Coast, but there's a lot of beauty here, and yeah, we wanna take advantage of that and celebrate it, make it as good as we can.
And very cool to tell a story while you're doing it.
Yeah, I'm excited about that. There's still a lot of work to do and a lot of ideas to incorporate, but we have funding. The state of Texas funded 3 major roads, a lot of utility infrastructure, and the park, for
Wow.
$123 million in the
That's
last legislative
amazing.
session. Uh, I think because the legislature recognizes that this region is there's nothing more important in the state of Texas economy
Mhm.
than the Permian Basin, and investing in the Permian Basin is good business for Texas. And what we're doing is really intended to advance the basin, to make it a more successful and sustainable economic engine for the state. So it was pretty easy for people to see the synergy, and we've been really blessed that we've had substantial state funding, and of course, unbelievable private funding. Well, but the parks and the roads are, I think, we're going to be fully funded by that state appropriation, which is really
Wow.
exciting.
That's remarkable.
Frees up the private money to build the healthcare facilities and
Yes.
the other things that are ahead of us.
And you've been in healthcare in the Permian for more than 20 years. We've talked about it a lot, but was there ever a point when you first got here that you thought the Permian Basin could be where it is now?
That's a good question. You know, I always thought we could be better, from day one.
There's always room for
There was
growth.
plenty of room for growth. Uh, I don't know that I really envisioned the the effort that the companies here have made to come together, to set aside their competitive instincts for the good of the region and
Mhm.
work together on things where they could work together. They're not colluding on their business. They're
Yeah,
trying to make the
yeah.
communities better together. And I don't know that I had a vision that that could happen. And it's incredible that it has. I'm thrilled to get to work with people like Travis Dice, who were among the architects of those ideas. But it took that for us to take this next leap forward, and we're it's going to be years before we really have realized the vision completely. But it required that kind of cooperative spirit, the idea that Midland and Odessa can cooperate and do
Mhm.
things together that benefit the whole region. Um, those are big steps forward that I'm not sure I was ever uh, a vision enough of a visionary to believe that that stuff could happen. I'm really grateful that it has, and we're really blessed.
And what do you think the collaboration of those entities and those people says about our communities?
Well, I think more than anything else, it says that we are able to recognize what we need, and we're not afraid to do what it takes to make it happen. And that's not true everywhere,
Mhm.
but by a long shot. I still remember one of the early impressions I had of Midland. I came here from Montgomery County in north of Houston. That's where my last job was, and I was involved with the United Way there. And we had pretty active United Way, pretty rich community, 3 times the size of Midland
Yeah.
County. And our United Way in those early days was raising about $1.5 million a year, and we're pretty proud of that. We got to Midland, and we were routinely raising over $3 million a year in a community a third the size,
You're like,
and
"Oh."
nobody was satisfied with that was enough. And there was a foundation, or some sort of philanthropic entity, felt like on every corner. And I thought, this is an extraordinarily giving and generous and committed community. And I should have been smart enough to recognize that we could make that into something that really made the community better. And it wouldn't happen without that kind of spirit, that kind of pioneer mentality that says, we're out here and we can't really help. We can't expect anybody else to do things for us. We need
Mhm.
to put our own resources together and do them ourselves. This is what we get, and we'll continue to be blessed by that for many, many.
I know, and I'm from the Houston area too. It is so hard for coming from outside the area to realize how if Midland was all on its own, it could still get everything done, even Odessa, the Permian as a whole.
It's amazing. It really is, and we're so far out here that we kinda have to
Yeah.
in a lot of ways. So we're really fortunate to be here, and I didn't I told you before, I didn't know anything about Midland. I'd never been here before, but it's a really extraordinary place.
Do you call Midland home now?
Not really, no. I mean, it's been home for a long time, but I still have living parents, and my
Mhm.
wife and I both have siblings all in Houston. Our kids and our son is there already, and our daughter probably will be there one day. I think Houston's still home. We probably end up retiring there, but this is as good a second home as I could imagine.
Yeah, it'll always hold a special place in your heart.
Absolutely will. Yeah, I can't this the best part of my career, the best part of my professional life has been here, and I'm always gonna be proud of it and hope to see it continue to grow and do good things after I'm gone.
And if you could leave West Texans with one message about the future of healthcare, what would it be?
I think it's unlimited, honestly, and I think, it's only limited by your imagination and your willingness to support it. A lot of the things that we need to do are not really self-supporting, so they need the community to step up with the financial resources to make things happen. But people do that here.
Mhm.
I don't have to tell them how to do that, but, that will be necessary to do all the things we wanna do, but they're all doable, and I hope that people won't none of it will be easy, it'll take a lot of work, but it's worthwhile to do it, and I hope people will stick with it because it's all doable.
Is there anything else that you'd like our listeners to know?
Thank you for supporting us, for paying attention to what's happening. You're gonna hear a lot more about the Beacon in the days ahead.
Mhm.
My board is always after me to make us more visible, and we haven't had a whole lot to say yet. We've been
That's a
building
great story
we've
to
been
tell.
building the groundwork, but we've got a lot of great stories going forward, and you'll see us become much more visible in the days to come, and I hope you like what you see.
Russell, thank you so much for sharing your time with us today.
Thank you too. Appreciate it.
Everyone, on behalf of Russell and myself, that does it for this episode of Fueling Tomorrow. We'll chat next time.